In today's time, the health systems continue to grapple with the complex challenges of delivering accessible healthcare services. We have seen that community health workers, the workforce we have, which for a long time we did not even acknowledge as a system that they can play a role. Today they are at the forefront of this effort which all of us are making. They are the unsung heroes which bridge the gap in delivering the essential healthcare services to the underserved population.
10 years back, we were using not just papers. We are using these big books, and we'd go with them to the community, and you want to register households and render your services to the household, and it was really bulky, and it was really stressful. Thanks to digitalization, I only carry my MOH 100, my smartphone, and a pen. It's lighter, and my book, my red kit bag. So it's lighter and it is easier, and it has given me easy time in the community, and it has also given me good recognition in the community.
One thing that we need to think about as we think about digital tools, I think the first thing from a partnership perspective is how do we partner with the communities? How do we ensure that the tools that are developed are human-centered design, that they really fit to the local context? And one tool for one country might not be fully suitable for another country. On what are the needs for the government, what are the needs for the country, and how do we bring everybody together and ensure that then there's an alignment even with the donors, so that then instead of having small investment, very scattered, and sometimes some duplication, let's be honest, and I think we're all sometimes, many of us could be culprit. But how do we ensure that there's greater alignment so that then we create greater efficiency, and at the end of the day, I think we can have tools that can be more sustainable.
Work that we tend to start on digital health is usually digitization to begin with. So just simply convert your big bulky registers into an app. To be honest, I used to be very critical about why are we just looking at digitization, right? There needs to be some transformation element built in. But now I've come to an understanding where I believe it's perfectly fine if it's just an efficiency play to begin with. So we go through that phase where we build efficiency, and I'll add the time-saving component as well. As you called out in terms of just once you get familiar with the tools, how much time it does it take to input that data, the reminders, and then move to a phase where it becomes a job aid tool, just for the users of the tool itself.
Africa needs 2 million community health workers to achieve our UHC objectives. And we need all those community health workers and community health promoters to be connected and equipped with the kind of tools and capabilities that Deborah has. And at the same time, when we talk about primary care, it's not just about community health workers. I think we also need to think about rural facilities, health centers, the places where Deborah has to refer some of the patients when she cannot provide the intervention that they need, at least at that first level. And we are talking about at least 100,000 health facilities that need to be equipped. In my role at Africa CDC, the absolute top priority is primary care digitization.